And so as I alluded to and others have, this cancer can be quite chemo-resistant. And even if it does respond, again, chemo is something that's hard to be on kind of indefinitely or intermittently. And so this is some of I'll kind of show this in a second, some of the response rates to chemotherapy. But they are quite low, both in the neoadjuvant, meaning that setting where you get chemo and then you have your upfront surgery, so that's the neoadjuvant setting, and then in the recurrent setting. So we did a study at MD Anderson where we looked back at patients who, with low-grade serous ovarian cancer who had neoadjuvant chemotherapy, and basically compared it to a similar group of patients in a different database that we have that we kind of matched based on their characteristics with patients with high grade to really get a sense of how are patients doing, what's the difference. And I don't know if people have gone through how to read a waterfall plot with you, but when disease shrinks, it's on the bars go down from the zero. That zero is that kind of middle line, and when the disease grows, it grows up. And so you want to look like the bar graph on the right, the high-grade serous, where you see all of that blue. You want the disease to shrink. But what we found with neoadjuvant chemotherapy is it really looks a lot more like the left. And those blue bars are the patients that had true responses. And so what that means to us is whatever they're measuring is at least 30% smaller than it was. So it's very kind of technical in trials, what we define as response. But that's what response means to us. And so it's just obviously much fewer than we would like to see. And this is seen also in recurrent disease as well. Dr. Gershenson did a study back in 2009, again, retrospective, looking back at groups of patients that had chemotherapy in a number of different regimens. And, one of the 108 regimens that they looked at had a complete response. 3 had a partial response, and so that overall response rate, again, everybody that had at least 30% or better, was only about 4%. And that was better, a little bit closer to 5% for people who had been a while since they'd had a platinum-containing drug, so we consider that platinum sensitive, but even less so if they either grew on the carboplatin. So not super exciting. Now, a number of patients had stable disease, but again, with something that's so toxic, I don't think that's good enough, and I think you'd probably agree we need something better than that.